happiness, health, well-being. These goals bring thousands of women and children to the doors of the Angel Harvey Infant Welfare Society of Chicago Community Health Center each year. For them, infant welfare represents more than affordable, accessible health care. It is their home, their family, and the promise of a bright future. For nearly 100 years, the Infant Welfare Society of Chicago has built a tradition of visionary care, providing quality, community-based services to uninsured and underserved women and children of Chicago.
The primary purpose of the Infant Welfare Society has been since our beginning in 1911 to provide health care to women and children in order to provide a good foundation to get these young families off to a good start.
Laura's daughter Sol began life with overwhelming complications.
Wow, the thing is, when I was pregnant, everything was fine until she born. She was 2 pounds when she born. She was so little.
She has Down syndrome. Sol had very frequent appointments during her first year of life to see how she was doing and to see how her family was doing.
Sol has received comprehensive therapy and medical treatments over the past 2 years, and the family has obtained additional emotional support and education at Infant Welfare.
Sol is doing fabulously. Sol is learning to walk. She's talking. The family is doing just fabulously.
Now that she's walking and she could say hi, she say, Mama, I love her so much.
Sarah and Daniel are taking their first steps in the lifelong adventure of parenting. They're expecting their first child and have come to Infant Welfare for Sarah's 4-month checkup. For Sarah and Daniel, awaiting the arrival of their first child is exciting, but also stressful.
Big issue, we were worried that we wouldn't have enough money or about a place to live.
I just was like, oh, wow. I already have stuff I have to pay for, and now a baby, and I know that's expensive.
Well, my concern is that if this clinic didn't exist, I think a lot of people would not be getting the service that they need, at least not to the quality level that they're getting it here.
Each life is touched by individualized care provided at Infant Welfare's Logan Square Clinic. From routine dental checkups to treating a severe medical condition, Infant Welfare is making a difference, one patient at a time.
We see a lot of challenging cases, a lot of crises on a daily basis. We're all here for the same purpose. We all want to help families to get to a better place.
Manuel Garcia came to Infant Welfare because he had weak muscles and his legs were not developing normally.
It was a scary moment for him back then, so we didn't know what to do. He couldn't walk on his own. That was the first part. It was not just physically bad for him, but it was emotionally really for us that at 2 years he couldn't do nothing.
Manuel was not walking, he was underweight, he wasn't eating too well, and he wasn't speaking.
Within a couple of months of him receiving therapy, he started walking on his own. Now he is he's a normal 3-year-old kid. I don't want to say that it's been a dream coming true because he is a dream just to have him. Now he comes with me to the park. I can bring him to a soccer game. Things that I was always wishing that I could do before. Now I'm doing it.
Infant Welfare Society treats the whole person, not just the condition.
We really believe in a holistic model of care here at Infant Welfare Society. A typical pediatric clinic or medical clinic treats the body and treats to make sure the baby's okay and sends them on their way. We don't believe that that's the only thing that matters.
The range of care provided by Infant Welfare is unmatched in a community health setting. Pediatrics, prenatal and whole women's wellness, dental and orthodontia, ophthalmology, Healthy Steps child development, social and mental health services, literacy and language outreach.
Thanks to Infant Welfare Society, I was able to get all of my services for my daughters in one location. Every single issue that we have to address, we're able to come here and get it done.
Infant welfare was formed when community leaders came together nearly a century ago to reduce infant mortality by providing safe milk at stations throughout the city.
Our roots have always been working with women and children, beginning in 1911 with the clean milk.
With a history of identifying needs and delivering innovative quality services to meet them, infant welfare stands alone in its tradition of visionary care. A private nonprofit created and guided by leaders from business, philanthropic, and medical communities, infant welfare depends on individual, corporation, and foundation contributions, grants, and support from its auxiliary to carry on this independent tradition. Without the continued generosity of the community, infant welfare could not touch lives each and every day.
All of us have that drive to make a difference.
Whether it's patients who have chronic diseases or it's a healthy child who's coming in for their checkup, we know that we can impact these patients.
Because you're touching so many lives and you see so many patients each day. But if you just make one little child to get to be the best that he can be and meet his potential, then you know you've succeeded.
With your help, infant welfare can continue its tradition of visionary care for women and children and hope for a healthy and happy future for generations to come. For Sarah and Daniel's first baby. For Sol and her family's struggle with Down syndrome. And for Manuel, whose first baby steps become big strides in life. Infant welfare has made a difference, and so can you.